presentation. We'll move on to the next presentation. Dr. Chaya Bharati, Give Me Sunshine, I Want to Grow.
Give me sunshine, I want to grow. To introduce, incidence of ROP is 20 to 30% of screen preterm newborns. Myopia in severe ROP is 58% according to ET ROP study. History of laser is seen in 70% of ROP cases. According to Won et al., infants with history of laser in severe ROP, early and rapidly progressing myopia, they develop. And Glennock et al. Said that higher myopia in laser eye as compared to those who received bevacizumab for zone 1 ROP. Bunker et al. Studied 63 eyes with severe ROP and injected intravitreal bevacizumab, and no reactivation was seen after 1 year. My objectives are to evaluate the efficacy and safety of intravitreals without laser as primary treatment modality in AP-ROP with plus disease. Zone 2 stage 3 involving 1-2 quadrants can be observed to prevent laser-induced myopia to buy time for retinal growth. Method, 35 eyes of AP-RP was studied, 14 eyes had plus disease, 13 eyes had zone 2 stage 3 ROP, in 12 eyes intravitreal ranibizumab 0.025 ml was injected, in 3 eyes biosimilar was injected, in 4 eyes reinjection was done, and follow-up was done on post of 3rd day, 1 weekly for 1 month, monthly for a year, yearly till date. Monitoring of systemic ocular neonatal and pediatric neurological developments done in collaboration with the neonatologist. Outcome at 1 to 5 years of post-injection, regression of ROP was seen. These are few photographs of the AP-ROP plus disease, and a case of AP-ROP, again a case of AP-ROP with plus disease, and AP-ROP in twins with plus disease, a case of AP-ROP, few photographs that has been taken by mobile, and a case of AP-ROP. Tortuous vessels at zone 2. With my results, 35 eyes have been studied and 22 were found with AP-ROP. Plus disease was seen in 15 eyes, and in 12 eyes ranibizumab was injected. In 1 eye biosimilar was injected. 2 eyes got lost to follow-up data, and after 3 months were found to be normal. And reinjection was done in 4 eyes. In 2 eyes without plus disease, biosimilar was injected. In 13 eyes, zone 2 stage 3 was seen, in which observation was done. But in 4 eyes, stage 4A was developed at zone 3 in 1 eye, at zone 2 in 3 eyes. Reinjection with laser was done and found to be stable. Follow-up of 35 eyes, 4 eyes lost to follow-up and lost. Mean birth weight was 1,033 grams. Mean gestational age at birth was 29.2 weeks. Mean age at the time of injection was 1.6 months. Resolution of severe neovascular plus disease was seen. Decrease in venous dilatation and arterial tortuosity. There was a resolution of NVI on 3rd day. Fibrovascularization disappeared in 10 to 15 days. Progression of retinal vasculature beyond neovascular tissue into peripheral avascular retina was seen. Out of 35 eyes, only 4 eyes were lasered. Detached retinized floating live in vitreous cavity. These are the post-injection photographs. And this is after second injection. And the pre-injection photographs, post-injection photographs, AP-ROP cases. We can see a ridge. The ridge got resolved itself. AP-ROP pre-injection photograph, the post-injection photograph, post-injection photographs, and lost to follow-up return case after 3 months. These are the photographs. To discuss, anti-VEGF immediately halts neovascularization in moderate to severe ROP, useful in progressive or unresponsive rush disease, advantageous in rigid pupil, hazy media, in sick babies in whom laser would be difficult, allows vasculature in previously avascular retina in developing eyes, prevents complication of lasers like visual field loss, myopia, amblyopia, cataract, and anti-segment ischemia. The shortcomings of my study was that it was small, duration of study was short, angiography not done, fundus picture not available every time. To conclude, after 5 years of follow-up of intravitreal injections, they are safe and effective modality of therapy for moderate to severe ROP. Less myopia is seen, no strabismus seen, and no reactivation seen. The take-home messages. Decision of lasers can be delayed or avoided. Most of the lasers are done due to fear of RD or the patient may get lost to follow-up. Laser-induced myopia is preventable. Not all AP-ROP needs laser. Not all ridges land in RD. Intravitreal injections can be used to delay or cancel lasers. This is a photograph showing a lasered fovea done elsewhere. These are my references and these are my few happy patients. Thank you.
Thank you. Your presentation, you have only repeated in 4 cases anti-VEGF.
Yes, sir.
And rest you have not seen any PAR so that you
Yes.
should be able to do the laser.
Yes, sir.
So 1.5 years you have not done
5 years, sir.
5 years you have not done laser in
Yes,
those
sir.
who have been injected once anti-VEGF.
Yes, sir.
And this is a great study. I mean, what could have been developed if you have not done laser? Because people are doing 80 to 90%, 95, they are doing the laser after anti-VEGF or giving second injection. And second, the observation stage 3.
Yes.
It is observation or patient didn't came?
Sir, I always...
You can't have a observation in such a ROP.
Yes, sir. I always observe how many clocks have been involved. Supposingly the patient is landing in stage 3, then if only one or two clocks are involved or 3 clocks are involved, we can observe. And I always ask the patient to come on time. The time limit that I give to them 10 days or 1 week. And this is how I closely follow them. The moment I feel that the ridge is getting too much elevated and then it's moving upwards, then I have to take the chance of lasers. Otherwise, I keep observing. And till my 5 years, now I can say it's 6 years, I have seen that there's no reactivation seen and the patient is also not developing myopia. Only in 2 eyes I have done the re-injection also. But that patient is now 6 years old, has not developed myopia even. Though the fundus picture is appearing like a myopic look, it's giving a myopic look. In future, he may turn to be myopic, but right now he's doing well.
Okay. You should present because many people are doing laser after anti-VEGF.
Yes.
That will avoid if you do double-blind study.
Yes.
So that, okay.
Your presentation, you're saying myopia, madam, but you haven't presented data on myopia in this particular
I
paper.
agree, ma'am. Yes.
So that conclusion we cannot draw on this paper. I do agree that you are not seeing. What I find interesting is that in your table of patients that you showed, you had 2 babies in the AROP group who you said became normal without treatment. And then you had these 3 or 4 babies in your zone 2 stage 3 which you chose to observe, but they developed stage 4.
Yes,
that
sir.
is that is where I have my concern.
And
so the decision, as you very rightly say, 1 or 2 clock hours you may not treat, but the presence of plus disease is the most important criteria that you need to mention when you are telling this. That is the thing.
One quick comment. So in aggressive ROP, when you're treating posterior disease, in most of the times when you're using short-acting anti-VEGFs like ranibizumab or the biosimilar, the vascularization progresses, but there is a lingering peripheral avascular retina in most cases. Now, whether you choose to laser that or observe that is a different thing. But how were you monitoring? Because you didn't do FFA. How did you monitor these babies when they were growing up? Because once they put on weight and they are in that 8 months, 10 months old, you cannot see the zone 3 at all. You can't put a speculum. So what did you do for those cases?
I always follow 2-3 criteria for my judgment. One is that the patient is 2-3 things are important. One, the repeated blood transfusion, repeated neonatal admissions, and for like fundus examination, like you're asking that 10 months or 1 year, maybe we cannot do the fundus examination. I always ask them that let me do the fundus examination. I always, when the baby comes to me, then I say later on we will have to do the fundus examination under sedation. So this is how I follow up my patients.
So you did use general anesthesia or sedation when they grew up?
Yes, ma'am.
Your methodology needs to clarify those things. Anyways, thank you, madam. Nice presentation.